Chapter 5, Health Promotion of the Developing Child. Factors influencing growth and development are listed on your screen. Genetics is one aspect that can influence growth and development. We look at both physical and psychosocial aspects of environment when we see how they can affect growth and development. Prenatal exposure to substance can affect it. Poverty is another reason, as a woman may not have the resources for adequate prenatal care. Nurses can use anticipatory guidance to educate on environmental hazards such as sunburn, secondhand smoke, playground equipment are a few examples. Culture is the way of life of a group of people, including their habits, beliefs, language, and values. Growth charts are not typically a true tool to use from other cultures, as some cultures are much smaller in stature and don't reflect this. Nutrition is a big part of growth and development. The CDC lists the common nutritional factors regarding nutrition as inappropriate food, advertising directed towards children, decreased access to affordable food, available of unhealthy sweetened drinks are a few. Overall health of a child will affect growth and development. Many acquired or inherited diseases can affect nutritional status. Family relationships can be a big factor in growth and development. A family that is overly stressed does not function as well, and many times this can affect the children. Helping the parents cope with stress is needed many times. Parental attitudes can be a big part as well. If the parent isn't concerned with growth and development, they may not offer the child certain opportunities to enhance development. Not that a parent has to go out and buy expensive toys, but providing a variety of things that stimulate and motivate the age is huge. When you hear cognitive development, think Piaget. We will discuss each of these when we talk about the different ages, and there's a nice chart in the book that lists different theorists of growth and development. Sensory-motor period is from birth to 2 years. Reflexive behavior is how it starts out in the infants and moves to more complex. They understand the object permanence. Pre-operational thought is from age 2 to 7. Language will become increasingly more useful. Their thinking starts out egocentric and then begins to look at another's point of view. Magical thinking and animism, that is the perception that all objects have life and feeling, happen during this period as well. Concrete operations is from age 7 to 11, and they can distinguish fact from fantasy. The concept of time is more clear during this time. Thinking becomes more logical and systematic. Formal operations is 11 years to adulthood and features abstract thinking and futuristic thinking. Nursing implications include that in order for a child to be interested in a disease process you have to look at these cognitive theories and use these as a guide as how you will educate. A good example is an 11-year-old who is diagnosed with type 1 diabetes. Using a teaching that tells them that if they don't control their blood sugar now, they may have kidney failure 20 years is not appropriate. Although they are starting in the formal operations, they are not ready to think that far into the future. Erickson's is the one we really look at in nursing. We will discuss these stages with each age group that we talk about as well. Plus, we are only looking at the ones that are from the pediatric population. Trust versus mistrust is birth to 1 year. You need to develop trust for healthy personality. This is done by parents caring for baby's needs. Baby realizes they can cry and get fed, changed, or just soothed. When a parent doesn't provide this, then mistrust develops. These are the kids who can go through failure to thrive. They need to feel that trust to grow. Autonomy versus shame and doubt is 1 to 3 years. They want to do things for themselves. They're able to try new activities. Shame and doubt happens when they do try new things, but they are made fun of or shamed of for how they do things. That does not build their self-confidence. If it continues, a child can become very withdrawn and afraid to do anything. Initiative versus guilt is 3 to 6 years. Big imagination. Explore with all their senses. They begin to develop a conscience. They learn to manage conflict and anxiety. The feeling of guilt occurs when there are too many rules and regulations from adults. They experience too many failures. Industry versus inferiority is 6 to 12 years. They want to engage in tasks and activities they can carry through with. They take pleasure in what they are accomplishing. They learn to compete with others and cooperate with others. Inferiority develops when there's too much pressure is put on them and they cannot complete everything. They feel they cannot measure up. Identity versus role confusion is age 12 to 18. Formulating a sense of self and belonging. Those who are confused have a hard time forming and maintaining relationships. Nursing implications include teaching parents about regression. Regression is when a child can revert back to the behaviors that happened at a younger age when a stressful situation is happening. This is common when a child is hospitalized. They may have been potty trained but now is incontinent. We educate parents that this is a normal finding and should correct itself once the stressful situation is resolved. Language is important to growth and development. Passive or receptive language is the ability to understand the spoken word. Expressive language is able to produce meaningful vocalizations. Many people use facial expressions and hand movements as well. Crying is how an infant communication is needed. Most parents can distinct different cries and can determine what their child wants or needs. By age 2, children have a vocabulary of about 300 words and can say simple sentences. Nurses need to assess language and voice concerns over any language delays. Development age is level of functioning. Observing a child during times of eating, playing, toileting, and dressing, the nurse can determine if the child is developing appropriately or is having any delays. There are a variety of developmental tools that can be used to help determine the developmental age. These tools should be easy to use and easy to decipher. It should be part of every well child checkup. A very popular test to use is the Denver Development Screening Test 2. It's a widely used test but should only be administered by someone who has been trained and certified to use. One role of the nurse is to do a developmental assessment and use anticipatory guidance to educate parents on normal growth and development. The nurse can gather information regarding the child in various forms. There are standard questions that the nurse can ask the parents. A few of these include, what does your child like to do at home? Can your child throw a ball, ride a tricycle, climb? Can your child draw pictures, color them? The nurse will assess how well the child can think through a process and communicate verbally. Also, how does a child interact with other children and adults? They will look at the child's emotional stage as well. They will gather all this information to help determine if the child is showing any developing delays. Careful observation of the child can really tell you how that child is doing. Solitary play is when they play alone with toys that are different than those used by other children. They enjoy being close to others, but they just have no interest to play together. It begins in infancy and is common in toddlers. Parallel play is usually with toddlers. They play independently but among other children. They play with toys that are similar. There is no group association. An example could be each child's playing with blocks, no sharing of the blocks, and each is doing their own thing. Associative play begins in toddlerhood and continues into preschool. They play together and they're engaged in similar or identical activities. They borrow or lend from each other, but there's no real group goal. An example could be playing with Play-Doh. They can share the tools to create their own individual masterpieces. Cooperative play begins in late preschool. This is organized play and they play in a group with others. They discuss and plan how it will go. One person is the leader. An example is when they play house. Someone is the mom, who's the boss, of course, and that person assigns the other roles. Many times she will tell each person exactly what to say. Onlooker play is when they watch other children but do not have an active part playing, typically at the toddler level, but they can be at any age. The function of play that will enhance sensory-motor development is when they're using all their senses to explore, and it also helps with intellectual development. Socialization, they can learn by playing with others. Creativity, they learn. They can use their imagination to create self-awareness. It helps teach morality as well. Immunizations are important for children. I'm not going to make you memorize which ones they need at which age. Box 5.3 lists the barriers to immunization, so please review. Right now, the media plays a big part in the decline of immunizations. Informed consent needs to be provided regarding immunizations. This includes risk and benefits, side effects. Information regarding the vaccine should be provided in written form. This is known as the VIS form, and they're in their native language. The nurse must know proper administration guidelines for each vaccine. This includes proper storage and handling. The deltoid can be used in children older than 18 months, but the vastus lateralis is the most common site to be used. Many times a child will receive multiple vaccines at once. Careful documentation of which vaccine was given at which site is needed, so if there are any reactions. Nurses must be aware of precautions and contraindications for vaccines. Mild sickness is usually not a reason to hold the vaccines. If there is a reaction before, then you must look at the type of reaction and determine if another dose is appropriate. Education on the importance of the immunization is part of the nurse's role, providing accurate information to help parents make an informed informed decision is our goal. We will talk about nutrition in each age group we are talking about, so this will be a more general overview of how we will assess nutritional status. The anthropometric data consist of height and head circumference, which reflects past nutrition or chronic nutritional problems, which weight, mid-arm circumference, and BMI reflect current nutritional status. Clinical evaluation includes a physical assessment and complete history. A dietary history is not always easy to obtain. Many times a child or parent can't remember or are not interested in partaking in it. You can try to have them do a 24-hour recall where they document all food and beverages that were consumed over the past 24-hour period. A food frequency questionnaire looks at how often they eat certain types of food or food groups over a daily, weekly, or monthly basis. A food diary is where they will track what was eaten during a specific period. We must also assess physical activity. The CDC states children and adolescents should be physically active for at least 1 hour each day. Aerobic exercise should be the major component of activity, making exercise fun and habitual. A few others include persuading schools to provide regular physical education classes and encourage parents to find out what is in their community to help the child find fun activities to help keep them engaged in physical activity. Unintentional injury is the most significant but under-recognized public health threat facing children today. It's a leading cause of death in children. All children are at risk for injury, so we must educate on ways to prevent injury. Safety education is a crucial part of injury prevention. We need to increase the awareness of safety by talking to our patients and families about injury prevention. Anticipatory guidance is where we educate the parents and many times the child on ways to keep their environment safe to help prevent injuries. Teaching strategies can be formal or informal. Most children above 5 years old can be included in the injury prevention and the education we are providing. The parents must be included as well at this age. Using various forms of education is also beneficial.